Hi, welcome back to Mel's Health. I'm Mel, and as always it's lovely to have you here with me today. So I need a simple and very common surgical procedure, and it is coming up very soon. So I thought I'd talk about my experience up until now, tell you guys about what the surgeon has said to me leading up to this point, about the actual procedure itself, but also about the fact that I am prescribed blood thinners. And then once I've had the procedure, I'll make a part 2 to talk about the recovery. For those of you that don't know, I'm prescribed Warfarin and I'm on it for life because I have a protein S deficiency. But also in May of 2020, I also had bilateral submassive pulmonary embolism, which is multiple clots in both lungs, and I also had pneumonia at the time. But for more information on all of that type of thing, I've got plenty more videos on this channel, so please check them out after this one. So back to this procedure. I've got to have 3 wisdom teeth out, 2 on the bottom and 1 on the top, and they've all got issues in themselves, so that is why I've got to go under general anaesthetic and have a surgeon remove them. It's not as simple, just go to the dentist and have a tooth removal. Can't seem to do anything the simple way. But I also wanted to make a video on this topic because I see a lot of people online who are having to go for quite simple procedures or anything whilst they're being prescribed blood thinners, and there are a lot of anxieties around it, and a lot of different doctors will recommend different things. So I just thought I'd put forward my experience as someone who is prescribed Warfarin so you can see what I'm going through. So firstly, I had an appointment, just a regular dentist appointment at the dentist office. I had mentioned to them previously that my wisdom teeth do generally give me some grief. I had one removed before when I still lived back in the UK, and I wanted to know if anything had changed in there and if any more needed to be removed. So I had a regular old x-ray, and these are the findings and why they couldn't do a simple local anaesthetic and pull out job, which is what I had on my upper right wisdom tooth a few years ago. You can see that the one on the left side is just having a little lay down, but the reason why I ended up having to be referred to the orthodontist is because if you can see that tiny white line right next to it, that is the nerve in my jaw. So the tooth is very close to it, and they said they can't do a simple extraction. I was going to have to be put under and have it surgically removed. It's a super common procedure. Then the tooth on the right, it's a little impacted, so they wanted to have the surgeon take a better look at that one and said it might as well come out at the same time. And then the one on the upper left is up quite high, and it will apparently cause me issues in years to come. So again, they were just saying dip them all out at once. So leading on from that, I had a consultation appointment with the surgeon. We went over my entire health history and my current medication, and the funny thing was he spent quite some time talking to me about Warfarin and its history and what blood thinners do, like I wasn't already aware of that, but that's fine. He then referred me for a CT scan, which again, adding to the amount of CT scans I've had in the last year. But he needed to get a 3D picture of my jaw so that they know exactly how close my tooth is to that nerve, so he knows how he's going to approach the surgery. In regards to my blood thinners, he asked me for my therapeutic range, and he said that he didn't want me to stop taking them throughout and around the surgery. He wanted an up-to-date INR reading around about a week before the procedure. So at no point in this process am I going to be stopping taking any of my medication. I just need to give him an update a week before on whether I'm in my therapeutic range. If you need any more information on Warfarin or blood thinners in general, I do have another video on this channel, and I'll link it in the description at the end of this video. So from there, I obviously went and I had the CT scan done on my jaw, and then within a couple of weeks he had been sent the report and he gave me a call, and there was some news. So the tooth that he was actually most worried about, the one that was right near the nerve, is actually far enough away for him not to be overly concerned about it. He thinks it's going to be an easy extraction. But the one on the bottom right, the one that was just a little impacted looking, turns out it has a very rare condition, and he explained it like this. So teeth usually have a kind of womb around them, like a little protective layer, and when they usually remove teeth, you cut into that and then you remove the tooth. But that bottom wisdom tooth doesn't have that little cocoon around it. The tooth has actually fused itself to my jawbone. I think he called it ankylosis, That's what I heard on the phone. Had a quick look on Google. It looks about right, but I believe that's what he said. Very rare condition. But he said what that is going to mean is that they can't actually get rid of the whole tooth. He's going to have to chip away at it a bit, remove as much as he can, but he will have to leave a bunch of it in there. Otherwise, he would end up having to drill into my actual jawbone. And that can cause all other sorts of disruptions, but there's already a risk of other nerve damage as is, so he's not going to do that. So we booked a surgery, and all 3 wisdom teeth may cause me some issues. I've got the one that's close to a nerve, but far enough away that he's not too worried. I have one quite high up, the one that I mentioned earlier, and he said that once that's removed, it's going to leave a bit of an opening to my sinus cavity. So healing might take some time, it could lead to infection, and then I have the tooth that is fused to my jawbone because it doesn't have its little protective layer around it. So my risks of surgery are nerve damage, which could result in numbness to any part of my jaw, my chin, my bottom lip, and infection. He also said that once surgery is over, I'm probably going to feel like absolute crap for like 3 or 4 days. I'm not going to be able to eat solids for some time. I'm going to be living on shakes and soups, I think. So, I mean, it could be a good thing. I could do with losing a little bit of weight, but I think the first few days are going to be absolutely miserable. But this is where I'm at right now. Surgery is in about a week's time, and although I'm looking forward to not having continued issues with any of my wisdom teeth anymore, I am kind of dreading the healing process because he did not sugarcoat it. I think the first 3 days at least are going to be so horrendous, and I do also have some concerns around excessive bleeding issues just because I will be taking my Warfarin throughout, but we shall see. But I will try and get round to making the part 2 of this video once I feel able to and bring everyone up to speed on how the procedure went down, especially with me being on blood thinners. I feel like it is an important topic just because I see a lot of people online having to go for these kinds of procedures and getting different responses from the professionals that are involved. So I would love to bring you guys up to date with the things that I experienced being on Warfarin throughout this. As always though, I do thank you very much for watching today. If you're not already, please do hit the subscribe button because it does help get the content pushed out to others who may need to see it. And if you enjoyed what I had to say, then please do hit that like button. Thank you again, and I'll see you soon. Bye.